is the Joint Justice Oversight Committee. We're meeting, it is September 15th. We haven't met for 2 months, so we're just trying to get ourselves up to speed again. We do have a full agenda today, and we will also be meeting again in 2 weeks on September 28th. And we will work a little bit either later on this morning if there is time, or first thing this afternoon when we come back from lunch. I'm assuming it will be when we come back from lunch to have a discussion in terms of items for our next meeting on the 28th. There are some things that are sort of a given that we will be continuing some work on, and there may be some new items as well. So we do have a full agenda, and working up the agenda with Ben, our legal counsel, we went through the notes and some of the testimony that was received at our July meeting. And I would mention to the committee members, it might be important to go back to some of the documents in our July meeting in terms of the 2 items that we've got before us. One is dealing with Justice Reinvestment 2. And the next item that we'll be dealing with is our restorative justice here in Vermont, and the initiatives, and also looking at the geographic consistencies and equity with that. So I think the first document that would be really important for committee members to bring up from our previous meeting on July, in the middle of July, whenever that was the document that we received from Stephanie Barrett, Joint Fiscal Office, that really dealt with Justice Reinvestment 2 and the funding. We wanted to know a couple of things about Justice Reinvestment 2. One was in terms of how to collect the data to make sure we're achieving the outcomes. We're going to look at that. We've also reached out to the Council of State Governments and to see if David Demore could have testified today. He's unable to. We're going to schedule him for the 28th to continue that conversation. But we have some of the stakeholders here for Justice Reinvestment. And we also wanted to know what the effectiveness is of the investments that we've made to date. And that's why it's important to have particularly this piece here before you, because Stephanie did put down amount of money that has gone to Justice Reinvestment and what those items were: transitional housing, domestic violence, offender management system, and behavioral health services within DMH. So we do have those respective partners with us today. And then on the flip side of that, we also have some of the entities that carry out the restorative justice issues back in the community. So this is going to be a long conversation, and I would begin the conversation with the Commissioner of Corrections, because the bulk of the money does go through corrections. So Commissioner, why don't you go way down? I believe that's where the camera would.
We've got a couple other folks with us as well.
Okay, why don't you bring them up?
Derek and Kristen, if you want to.
Folks up with
Yeah, if you don't mind. Yeah, that'd be great.
Why don't they just sit around the table here?
Here, you don't mind if I touch?
I do not at all.
That would be good.
I will come.
So as
You guys want to
committee members,
draw around so the camera can see?
for committee members, I also keep in mind that we are charged with making a recommendation in terms of the Justice Reinvestment dollars. They do come from the bed savings of our out-of-state beds. And we do have an amount from the FY22 out-of-state bed line item. There is some savings there that will be allocated to Justice Reinvestment, but we are charged as an oversight committee to make recommendations as to where those dollars will go. and we have Marie from Joint Fiscal Office here to go through what those bed savings are anticipated from the FY22 budget and where that will go in the FY23 budget, I'm assuming. So we're going to need to weigh in on that today a little bit. And then we'll do a deeper dive on that at our next meeting on the 28th. So all the testimony here right now, keep that in the back of your mind that we'll have to make a recommendation for folks. So Commissioner, welcome. And if you could identify yourself for the record and the folks that you've brought with you.
Yeah, thank you very much. Good morning, everybody. My name is Nick Demmel. I'm the Commissioner of the Vermont Department of Corrections. Excited to be here with you guys and look forward to the next meeting as well. So as you mentioned, the department received a good share of the justice reinvestment dollars from last year and talked through the legislative session last year about the various ways that we might spend that in some areas that we were keenly interested in. I'll ask maybe Kristen and Derek to introduce themselves, and then maybe Kristen can give us a top-level overview of what the dollar amounts were, and Derek can speak to the efficacy and where we spent some of those monies so far and where we look to go as the year progresses. So do you guys want to introduce yourselves, and then we'll go into the presentation?
Sure. Kristen Calvert, Financial Director, Department of Corrections. Brief overview, the $771,170 came from FY21 out-of-state bed savings. They were rolled into FY22, and through that BEA process, we established the kind of three high-level buckets where the funds were going to be directed. $60,140 was for OMS enhancements. That's our offender management system. $300,000 to the Vermont network. We've done that through a grant. $417,030 was for community justice centers.
Can you go through those numbers again? I think.
Sure.
For people, start over.
Sure thing.
Slow down.
Okay. You got it.
Because we have before us, this is what we're trying to incorporate, and maybe Trevor, being on Appropriations Committee, can help a little bit, maybe, and maybe I can help a little. To date, in the Department of Corrections, transitional housing has received $6.35 million. And domestic violence has received $500,000. And the offender management has received, what's it, 60?
I'm looking at it.
No, don't look at that.
Oh, you don't want
No, that's later. So what numbers you gave pertain to a specific fiscal year?
They were FY21 out-of-state bed savings.
That's where we need, this is where it gets really complicated. Don't look at any of the documents, members, for today's committee meeting. Go back to the July meeting.
I'm there. I'm on July, but I also went ahead to the other Restorative Justice.
Okay, because you'll see to date how much has been appropriated to these programs. The numbers you just gave are for FY21.
And that's solely the JRI out-of-state recapture money.
And it was applied to the FY21 budget.
No, they were savings from that fiscal year carried forward into FY22.
Carry forward into FY22.
Correct.
So can you go through slowly those numbers again?
Yes.
For tracks.
Yes.
Appropriations Committee thought and Corrections and Institutions Committee thought.
Can you describe briefly what the million?
The $6 million is what I would call our base budget for transitional housing that was moved into the Justice Reinvestment Appropriation at the end of fiscal year 22 when that new appropriation level was created. So the $771,000 that I'm speaking about now is the 21 bed savings rolled over to 22 and then landed as justice reinvestment.
So does that include the money that we put in the previous? Dick, I see your hand up.
Yeah.
Go ahead, Dick.
Of the numbers that they're talking about right now, as a member of Senate Appropriations, who had responsibility for the corrections budget. I'm curious of how much of the justice reinvestment funds are covering what you would have done anyway. So in other words, would you do no transition housing, or would do less transition housing if it weren't for the justice reinvestment funds? Because I thought we had a separate appropriation for justice reinvestment funding. And so I'm a little confused by that. I don't think it was 6.35 million.
Correct, and we do. That was a new appropriation level that was created at the end of FY '22. And
Yeah,
all
but
the
just like
current,
when we talk about veggie grants, for example, there's a but-for requirement. So if it weren't for that grant, what would they have done? Would they have left the state? And I'm going to ask you to apply the same thing to correction spending. If it weren't for the justice reinvestment funding, would you have not spent that money? Or are we just supplementing what we'd already have spent and using the justice reinvestment funds for ongoing corrections costs?
I would say the 771,000 is supplementing what we already spent.
And that's where I think we have a failure to communicate, because the idea behind justice reinvestment was to fund things that you wouldn't otherwise be doing, like domestic violence programs, like whatever else you can think of. I didn't think it was to supplement ongoing expenditures of the department, which you would have had to spend anyway.
Right. So Senator, you're exactly right. And that 770,000 is spent on things that were otherwise not captured in our budget. So those, the domestic violence programming, the CJC study that we did, the OMS update that we did, those are all things above and beyond that we wouldn't have otherwise funded, but for the capture of these JRI funds at 771,000. The 6 point whatever million, that is already appropriated for transitional housing, and that would be core DOC budget. And so that 770,000 that we got here did not go to add anything to existing lines that were already in place in the budget. So I think we are in agreement on the JRI money needs to be spent on something in excess of what you otherwise would to essentially build out additional services or provide additional community-based supports to the population we're serving.
I think that we're in agreement. But thank you very much. Sorry to be, but thank you.
No, happy to do it. And I think that's a great question, Senator, to help clarify for everybody. I appreciate that.
Questions? Teresa?
So the 771, since it was FY '21 savings rolled into FY '22, does it then become part of the base in FY '23, the current fiscal year? Is it represented in any of the numbers that Stephanie gave us?
No.
No.
It would not become base. That's my
22
understanding.
savings will be available for 23. And it just each year will be a different number because there's different savings amounts depending on the bed count and vacancies.
So I'm familiar with how the Choices for Care program works and how that builds into the base going on. So savings does. So do savings build into the community base?
No, so
It's just one-time expenditures each year?
Each
Is that what
year,
you're
yes,
saying?
exactly.
Okay.
Yes.
Each year becomes a
Okay.
new one-time savings for the year ahead.
Okay.
But I want to clarify that but you're building that one-time savings onto a base.
That's my question.
That, Trevor, because that's the discussions we've had in institutions committee and appropriations.
Yeah, my understanding is of the 771,000, and Maria can correct me if I'm wrong here, we determined that, I think it was 360 was going to be added to the base. In other words, it was in FY '22 in the section C, in FY '23 budget for FY '22 use. And the 417 was one-time money. That's the way it's set up. That's my understanding. Okay, Maria, am I correct?
So, yeah, I mean, there is language in the budget that says, it's in this.
Maria, could you identify
Oh,
yourself?
I'm sorry, I'm Maria Bell.
You should come up to the.
Oh, okay, yes.
You may not be picked up
Okay,
by the mic.
okay, so, I'm filling in for Stephanie, who's on vacation, so I may not have all the details, but what I did do before coming here today is look through the budget that was passed for fiscal '23. And in that budget, the C section, which is C for current year, right? So that would be the '22 appropriation. That appropriates the dollars that you're describing that are carried forward from fiscal '21 into '22. And then there is a section also in this budget, also in the C section, that says that any funds expended on community-based service programs pursuant to subsection B shall be included in the subsequent year Department of Corrections budget for the same purposes at the same amount. So what Representative Squirrel described is correct. And if you are interested, you can find this language in the budget, and I've got the citations, and I mean, maybe it's more than what you're looking for, but that is my understanding.
So rephrase that. So the 360 of the 771,000, 360,000 of that would go towards the base funding. And then the 417,000 would go to one-time funding. But wasn't that targeted towards the justice centers
Yes.
Yes, that's correct.
and not restorative justice directly?
Oh.
It's kind of an indirect.
I mean, I think from the department's perspective, the community justice centers are our arm that does much of our restorative justice work through department grants.
I mean, restorative justice and justice reinvestment. You're
Right.
saying that the department sees our justice centers and part of the restorative justice work that they do as going towards our justice reinvestment.
Right, I think, and she has the statute in front of her, but I think it says that it must be spent on community-based services. And one of the best vehicles that the department has for community-based services is community justice centers that really do execute a lot of the justice reinvestment work that we're trying to do as a department. And we'd happy to talk through how we're spending that money and what we would like to do with it as a way to impact the justice reinvestment paradigm that we're trying to implement.
Was this as clear as mud for folks?
Well, I just,
Shannon.
so the 417,000 is one time for investment into Justice Center, restorative justice, and you're currently planning how to use that?
We have a plan in place and we're executing it. It's not all been spent yet, but we can detail that for you if that's helpful.
Yeah, because I'm reading actually what came from Derek, which is the scope of work to be performed, but it's not specific. It doesn't identify specific entities or activities. It's got bullets, but not specificity. So is there a timeline for that so that the investment can take place soon?
Yeah, if you'd like, we can explain how we spent that 417
That
and,
would be good.
yeah.
Just don't want to confuse the conversations of justice reinvestment and our restorative justice. I don't want to confuse, they're two separate things, but there is a connection with our justice centers. So I don't want to confuse the later testimony we're going to receive with this particular piece here.
Okay.
Okay? Does that make sense to folks? Teresa?
So I'm just going to summarize to make sure that I'm understanding. So I heard the department say that it wasn't in the base at all, but it sounds like it
That
was
was
360,000.
My error,
in the
certainly.
base.
Yes.
Okay.
the 360.
Okay, all right, that, and
Sorry
then
for that.
that's
Yeah.
okay. And then the one-time money going to the justice centers, the 417 is one time to build on whatever it is, that work that you folks have agreed with them. Okay.
Correct.
Okay, I'm
So
clear.
we get that.
Yes.
So the 6.35 million that's on this sheet.
Yeah.
For transitional housing, how much of that is your base? The 6.5 million?
Yeah, that's what I
Yes,
should.
that's
And is that 360,000 included in that 6.3?
I believe
Should be.
it should be and will be going forward as well.
Okay. Now that we've clarified this,
Okay.
continue.
Okay, so I'll hand it to Derek to talk about the 417, and we can talk about how the other pieces of the money was spent as well, but let's start with the 417.
So for the record, I'm Derek Mio Duvnick. My title is Community and Restorative Justice Executive, Vermont Department of Corrections. And Senator Lyons, the document that you just referenced was more specifically intended for the later portion of this morning's testimony.
yeah.
Because I believe the committee asked to better understand the scope of services
Right.
that the CJC's community justice centers provide. That document is taken from the grants and lays out that work. That work has been longstanding, continues to go on. It is not in the process of being implemented. It is happening every day throughout our 17 grant funded community justice centers. So just to clarify and to speak to Chair Emmons, distinction between the different pieces. So if it pleases the committee, I would suggest we hold in abeyance discussion of that document and bring it back in when it's more connected to what I believe the committee wants to know at 11:15 a.m. Now, also to Chair Emmons' point, there is a broader conversation about how the department is using the recaptured JRI savings. And in this case, some of those recaptured savings specifically went, I believe, as per the legislature's request, to support and expand or augment capacity of the CJCs. So in fact, there is a connection, although it is not blurry in my eyes, but between the two, but I want to make sure that that's a shared clarity.
So that would be targeted more towards the
17, yes.
417,000 because that's a one-time appropriation.
Precisely, and be happy to break down exactly how that money is, that 417 of one-time recaptured JRI savings is currently being deployed. And in support of that, if Rachel, you would be so kind as to pull up on the screen and I can distribute hard copies of a budget spreadsheet and walk us through it. And it'll track what our FY22 base general funded grants were, what JRI sourced adjustments we made to those grants in FY23, and what other uses of those, of all of the 417. So while Rachel brings that up, and Rachel, that's the FY23 CJC budget document. So I will also pass around hard copies of that while Rachel pulls that up, and there should be enough for everyone right here.
And that will have to be posted so that our two folks online can zoom in.
Everything is posted.
So this document right here,
Why don't we just share one?
This one?
I don't, has it been posted?
Is it the,
Because Rachel was just
I've got it
asking.
on, I've got it on mine.
Yeah, everything was posted.
that's it, I got it.
So it'd be FY23 Justice Center budget, is that the one?
Budget, yeah. You've got two Excel sheets. One is a much larger data spreadsheet that speaks to the services. And
Okay,
I hope and look forward to the opportunity to explaining that after 11:15 a.m. this morning. But the one you should be looking at now should just be
Okay.
a portrait-oriented columned spreadsheet. Looks like we've got that up as well. So when folks are ready, I'd be happy to walk us through this.
okay,
Great. So what you have here is on your left, the site, and we've done that by regional community as opposed to the name of the actual organization. But we currently have a total of 17 different sites, if you will, through which all parts of the state are served. So the services that run through these 17 sites are accessible, available, and delivered to every community in the state. I just want to make that point. Moving over, the first column you'll see after the site is what we consider to be our base budget sourced by general fund in a state fiscal year 22 was. Of course, we've concluded that year, but I wanted to contextualize this year with the differences above and beyond our base. So there you have what those sites all received in FY22, and that was just straight up general fund. That, of course, as you can see on the bottom, totaled $2,935,000. And then on top of that, we had approximately $20,000 to contribute towards a very successful statewide conference and training for restorative justice volunteers, including not only CJC volunteers, but we partnered with the Attorney General's Office and the Department of Children and Families. And so this became an actual statewide RJ volunteer conference and a very successful one. So that was the other use of that general fund. And then again, you'll see our total budget. Now moving over into FY23, that next column is GF sourced. By that, I mean general fund source. Grant adjustments. Basically, our base budgets were all but the same with the exception of two sites. You'll see in Addison and Orange, we took what was that $20,000 that we had allocated in FY22 towards that conference. And we wanted to try to right size the budgets in those locations a little bit. As you can see, they were both considerably lower than most all the other sites. Now, there are economies of scale, and there's a reason why they were lower, but our analysis suggested that there was an opportunity to bring a little better parity into our investments in Addison and Orange. So we added in general fund $10,000 to each of those grants. And that's really all kind of the general fund that we kind of had to work with, because otherwise, we encumbered it all through our base grants. Now enter the 417K in JRI funds. And so the next column moving over to the right that says FY23 JRI sourced COLA. After hearing clearly from our valued community partners that their grants had been level funded for many years, and of course there's upward cost drivers all down the line, we used some of those one-time JRI monies to source a cost of living adjustment at a 7% rate relative to what their FY22 grants were. So, for example, in Addison, they received $70,000 in FY22, a 7% COLA gave them $4,900 and so on and so forth. So the CJCs were very pleased, I believe, to receive that and understood it was predicated on one-time funds. Yes.
That's,
Go ahead. Yep.
that's my question.
Yes.
COLAs aren't typically one time.
I know. This is the best tool we had at the time, and we wanted to at least offer a recognition and.
So what have you anticipated, or what have the centers used those funds for, since theoretically, they, unless you're going to have plans to submit a budget request in your base budget for next year, or you have additional one-time savings that get rolled over that you can backfill this with.
Yep.
It'd be difficult for them to increase ongoing expenses.
Yeah, I'll defer to the commissioner in terms of our plans for a request on that. Yeah.
Yeah, so in this whole process, we met with the CJCs, the leaders of all the CJCs and talked through, ideas that they might have for us and ideas that we had for them and used that as a way to get some feedback before we made determinations. The one thing we heard very clearly was we would like a cost of living adjustment, recognizing and owning that it's a one-time cost of living adjustment. They said it's still that important to us. That's how we would ask that you spend at least some of the money. We are still working through the budget for next fiscal year that we'll present. And so I don't want to go too far down that road, but we recognize, and everybody was very clear on both the DOC side and the CJC side, that this was one-time money. But the fact that they had been, level funded for as long as we're aware, this was something that was important to them and their staff, particularly coming out of the pandemic where folks were really hurting.
Yeah.
So that is something that'll factor into our analysis for the budget this year. But again, I don't want to get too far down that road as that process hasn't been finalized yet.
Okay. I mean, obviously it creates an upward pressure on general fund coming into the next fiscal year. And so, okay, thank you.
Yeah, so
So we have Senator Sears, who has a question, and Senator Lyons.
Actually, my question is, I was under the impression that starting with last year, we were looking at justice reinvestment savings from out-of-state beds. If you had a reduction of 10 beds in FY '22, and that would be 10 beds. And then if next year you had an additional reduction of 10 beds, you'd now have 20 beds reduced, not just whatever you reduce each year. So that in a sense, you would be able to fund the COLA, if that's what you choose to do and the legislature agrees, with justice reinvestment funds, because you're not starting off each new year with the only justice reinvestment funds coming from the out-of-state bed savings. And I make this point because my point at the time that we were talking about this appropriation was, if we had done this in 2010, when we first did Justice Reinvestment 1, and we were spending, or we had 700 or so out-of-state beds filled, you think of the savings that we've accumulated over the years in correction spending. But we never did that, unfortunately. And so I'm hopeful that we're looking at this as a multi-year thing, so that whatever date we pick, if that's not clear in the budget, we need to make it clear in the next budget.
That was the impetus for my first question. It's like, if we have 771,000 in savings and we choose that 360 goes into base, which means it's ongoing, and then the 417 is one time, it's all the same dollar. So, I mean, meaning the legislature, made that choice.
We made that choice this last time. And I think what Dick is putting on the table is absolutely the reason why Corrections and Institutions recommended to appropriations to have a specific line item in the governor's budget for Justice Reinvestment 2, so that we can see how much money year to year we're building that line item. That's exactly why appropriations and the conference committee put in the language to establish that line item. And that's what you're seeing in this particular document. That's the line item in the budget. So when the governor presents his FY '24 budget in January, there will be a line item there. And the beginning number right now is 6.3 million for transitional housing. And based on any of the savings in the FY '22 budget that we're going to be talking about later, how much does that go on top of the 6.35 million? That's the goal. That's why there's a line item in the budget, so that we can keep track of the savings. So we don't look at it as one-time savings. It's an accumulation. Jenny?
That means whatever year we choose, we could say 10 beds this next coming year, and that's added to the 10 beds saved the previous year, for a total of 20 beds.
Correct. That's how we'll be able to track it. That's the hope.
Yep.
That's the hope. Jenny?
So I might open up another area of discussion, and so we don't have to have this now, but as data is being collected and you're making judgments about what the needs are, so it would be helpful to know what criteria are being utilized to do that. And that would include inflationary pressures, so that whether that's happening or not and how you're seeing that. And then all of the other challenges that we have. And then a sub-question of that is what attention, if any, is being given to a concept of prevention? Because the whole goal of this, obviously, is to, well, we want to help victims and help everybody else, but investment in prevention will, for me, is the longer term importance here. So maybe you could just talk about those two things.
Yeah, excellent questions, Senator. So on the first one, I think the remainder of Derek's presentation will capture the criteria we're using, how we're studying the real demands and needs from the CJCs to include staff pressures and other things, but also areas that the department is trying to identify for growth in the CJCs. We are where we are now. How do we keep enhancing and making them better? Because I think, at least I certainly, as the commissioner, since coming in, have found the CJCs to be just a remarkably effective space to invest money and I think bring the community-centered justice idea into Vermont very strongly. And they've been around a long time and been doing great work. How do we get them to that next level and just keep that ball rolling? But to your second question, as you well know.
Can I just ask, is there
Sure.
a list of criteria that you're using to identify the needs within each of these areas? I understand the differentiation here based on population and population-based needs, but are there criteria that you're using as you're looking at the centers and what folks are needing in those various centers? But we're going to get to that later. That's what I'm hearing. So,
In
okay.
a mere moment, if
I'll be fine with that if we get to it later.
Yeah. Your second question, I think, brings up something Derek and I have talked a lot about. As you know, the centers are actually funded by three different sources. Well, potentially four sources.
Some, that, I mean, there's a lot of variation.
But the Department of Corrections being one,
Some of them.
the Department of Children and Families being the other, and the Attorney General's office, and then some have local funding from their municipalities. And we each have different interests. They're kind of co-occurring interests, but the Department of Corrections, while we certainly want to prevent people from coming into corrections, ultimately that's not our charge. Our charge is to deal with them once they're in detention under community supervision or have been sentenced or in an incarcerated setting, and then hopefully in the communities. The Attorney General's office, though, is certainly interested in diverting people away from the Justice Center, from the justice system. And so we have a philosophical debate that is ongoing about how far forward does the Department of Corrections lean in preventing folks from ever entering our system. And I think that is a debate that's ripe for further conversation. And there's
and so much has been done in that area in terms of assessment, pretrial assessment and all of that. You know. So, but I'm happy to hear that there's a robust conversation going on.
Yeah, and I don't think there's there's certainly not right answers. Reasonable people can disagree on this stuff, but I do think that what Derek will just talk about in a moment is a study that we're doing. Will help us to understand how the CJCs are funded right now, and with our partners figure out, okay, where do we really want to focus them? And I think prevention is critical. So does the department contribute to that, or should another entity, or how do we change some of the way we fund them? I think all of that feeds into the question of, we want them to be doing preventative work to stop folks from coming in. Now, how does the state as an entity kind of adjust to make that happen? And whether it's DOC or whether it's a different justice partner, I think that's where the debate rests.
Is there anything that we will see in the coming budget that would elaborate on the differentiation between prevention and actual intervention and treatment recovery?
I can't speak to whether it'll be reflected in the budget. in the next year, because again, that process is unfolding, but we will have the results of a robust study that we're doing that will give us a kind of data and a narrative to follow that will point to where the demand signals are and where we think that there should be enhancements or where the work is really going well. So maybe that's a good segue to the study itself.
Yeah, that picks up on the JRI funding too.
I just want to bring the committee back to the justice reinvestment piece and recommendations that came from the Council of State Governments. In their work for 2.5 years with us, with Vermont, with the 3 branches of government, it became very clear that the DOC was getting the brunt of programs to help folks who are reentering from an incarcerated setting. And our partners in the community were not stepping up to the plate. So the justice reinvestment dollars are to go towards those community partners to help folks who have been incarcerated or possibly could be on probation who have not been incarcerated, to beef up those community systems and our community partners to help folks not reoffend or feed into the prevention piece.
Yeah.
That's the part of justice reinvestment 2. That is the goal of those dollars, is to beef up our community partners. One of those community partners happens to be a justice center, but there's many others out there. So I don't want to get this so confused that people are just focusing on the justice centers, because that's a whole different ballgame, and we're going to get into that because the justice centers have have different streams of funding and different goals at times. So we need to separate these two to understand the justice reinvestment piece first, and that those bed savings, those dollars go towards beefing up our community partners that are working with our offenders. And then the justice centers, we're going to get to that later on this morning, and hopefully at some point we can straighten out the multifaceted roles of the justice centers.
Right. So to that end, specifically in the JRI recapture that we had last year, we allocated the 417 to the justice centers. And to your point, Chair, the whole goal that, as we saw, we did a few things on the margins here really to support the CJCs, but we also then spent some money to really understand how do we beef up community supports, and in this instance through the justice centers, but certainly that work is happening in other spaces as well.
Because if you go down the list, we've targeted money to the domestic violence arena, the network, and we've targeted money specifically to the Department of Mental Health so that they can beef up the mental health system to help folks who are reentering.
Right. And those are 2 other critical areas from the department's perspective that we should be making investments because they are so important to the justice reinvestment philosophy that we implement in the state.
So the question, so Derek, if you can finish going through this, the question that we will have as a committee when we see the bed savings from FY22, will we make a recommendation that yes, you need to include that COLA for FY24 for the justice centers?
And I think we'll have more information for you and we'll make a recommendation as well, but we'll have more information to make an informed decision on that. And I think that's what Derek is about to speak to now.
Yeah, so again, just to recap, we sourced 7% COLA across all sites relative to what their FY22 allocations were, and that totaled $205,000. So that 205 was of that 417. That left us with approximately $212,000 of JRI money still intended in some way to benefit the community justice centers. We did 2 other primary things with that remaining $212,000. We, as the commissioner referenced, have engaged through a bidding process. We're about to finalize and execute a contract to do some pretty comprehensive public market research and strategic planning and facilitation, where we're bringing on a professional neutral outfit that specializes in the participatory democratic processes that inform our investments. This is, in fact, and I know Chair Emmons is well aware of this history, not wildly different from the original John Doble studies that, in fact, provided some of the basis through which the community justice centers came into being. We asked Vermonters what they wanted out of the Department of Corrections, and we responded through the design of reparative probations. 20 years on, we have these flagship entities called community justice centers. And we haven't taken the opportunity in now a generation of CJCs to step back and say, what's the next chapter look like? How do we best align these services that have efficacy based on their restorative processes with new demands? And some of that leads to the complexities and textures of that conversation that Commissioner Demo referenced about how much can we lean into the upstream pieces, and what are the hidden costs of doing that at the potential expense of other ways that we could apply restorative interventions with our furlough population. As we know, we have through JRI many more people in the community, not in a carceral setting, but are there ways that we can use the properties and principles of restorative justice to better adhere them to the social contract, if you will? So that's a really exciting scope of work that we're doing through a contract that has been capped at $100,000. So again, we spent $205 on a COLA with JRI money. We've encumbered up to $100,000 in a soon-to-be fully executed contract for public market research and strategic planning. And that left us with about $112,000, if you're following my math, of still unencumbered JRI funds. We had internal conversations within the department and external conversations with our partners. And one of the leading areas of priority within the community justice centers, the restorative justice community in Vermont, and frankly, nationally, is the recognition that these services need to optimize for the values of diversity, equity, and inclusion, otherwise known as DEI. That the predominant forces that have shaped a lot of institutional responses are in need of an active lens trained at racial equity. And so in recognition of our commitment to that, we've taken of that $112,000, $85,000, which equates to $5,000 per site across 17 sites. And we are also, albeit through one-time monies, which we are aware of and which we've made the CJCs explicitly aware of, we are also augmenting their grant through an equal $5K per site adjustment in their grants. So that's what you see on that next column going down, all those $5,000. Each site is getting $5,000 to enhance their DEI capacity building efforts that will extend to such things as who are you recruiting as volunteers? How are you reaching into subsegments of your population to make sure to the greatest degree possible that the people appearing and participating as responsible parties in these processes see themselves better reflected in who we call the community that is attempting to hold them accountable. We look to our partners as the sort of leaders in that, and we trust in our partners. And so that's a recognition of our trust and our valuing of that. Consistent with that are actually, I believe, some federal monies that are coming through the providers to beyond CJCs as well, and we can get into that later in the morning. So you'll see the $5K for each site, and then the $100,000 under the strategic planning, below that sort of bar. And that basically, when you spend down that $100,000 for the strategic planning, the 85K, there's about 27K, if you keep tracking that math, and I'm correct, still left unspecifically allocated of the one-time JRI monies. Now, we held a very successful statewide volunteer conference. Commissioner Demmel, Attorney General Donovan, and DCF Commissioner Brown all participated in that. Dr. Nasreddin Longo gave a keynote address. The theme was equity and inclusion, diversity. We want to hold out some money, but the exact amount to be determined in that. So you'll look at the bottom right where you see volunteer conference, the exact amounts to be determined, but it's going to be drawn from that remaining 27K. And for the most part, we encumber up, almost every single dollar, but we do sometimes want the ability, if there are situational responses that might arise with one of our grantees, sometimes we're tied into municipal structures. So for example, if a municipality does a pay grade review and the pay grade for a CJC director at a municipal site goes up, then there's an upward pressure that if we can, we might try to respond to. So if you're interested in what we might do with the remaining approximately $12,000, I'm giving you a situational example of why we hold that. But for the most part, we get it out to our sites. So that is a rundown of the $417,000 in the one-time JRI monies and how we have either encumbered and or already expended them. And we look forward to a very robust report that will have recommendations about structural issues that came up this morning. And to your questions, Senator Lyons, I don't want to lose track of them, about how do we determine the need? So I think there's a couple levels to that conversation. One is this broader level of where are the things that activities that DOC will fund through this scope of work, which is currently documented in this attachment A. This is part of our grants and we can go over later. The other question speaks to our analysis of the different services that we do fund, the data-driven volume of referrals for those services, some which are directly controlled by corrections and some which come from the court or other sources. So it's an interesting prospect in that we control the kind of faucet of demand, if you will, for some of the CJC services, but not all. But what we do to try to get a little more of a data-driven sense of the need and the demand is we try to construct budgets using the basic metrics of what it costs to have part or full-time positions. These are grants. Grants are intended to procure capacity. They're not contracts for specific cost basis services. We're providing money for humans to facilitate this work. And those tend to be best measured in terms of part or full-time positions. So we've got some economies of scale or cost of doing business. We look at the historical 3-year averages of the services that we currently fund and the quantitative demand for those services as represented by the number of referrals. And then we try to intersect that picture of demand with the supply side, which is of course the funding that we consider what does it cost in this operating environment to have a part or a full-time position and what's necessary. So I'd say it's a responsive approach to building, capacity-driven grants. And we look at it, from year to year, but our 3-year average approach protects us from making any wildly varying decisions year on year, especially when we have things like the pandemic. So I'm happy to take any more questions and unpack that data either now or later this morning too.
So I want to move this along because we also have 2 other partners that we need to hear from, the network as well as DMH, in terms of the FY23 expenditures and how much has been expended. So I want to tie this piece up and move to Sarah Robinson with the network. Is there any final questions from the committee members of DOC? The Justice Reinvestment 2 funding. Thank you. You'll be back in the hot seat shortly.
Great. Thank you.
Thank you. So, and then after Sarah Robinson, I want to hear from the Department of Mental Health on their 400,000 that was appropriated in the FY22 budget for that. So welcome, Sarah. If you
Thank
can
you.
Identify yourself for the record. And as you picked up the gist from our previous conversation with DOC, we're interested in terms of your $500,000 that you have currently and how much of that's gone to justice reinvestment, and what is the programs that have been funded with that. So welcome.
Well, thank you so much for the opportunity to be here. It's wonderful to see you all. It's always a pleasure to be able to come back to the legislature and report on funding that you allocate that is doing great things in the community. And so that's what I'm looking forward to speaking with you about today. And before I started, I wanted to note from our perspective, it's always a bit of a process when funds are allocated to get them, from a state agency out into the field. And I just really wanted to lift up and thank the Department of Corrections, which has done a really exceptional job with our funding, our JRI funding, making that process as smooth as possible and getting those funds to the field as quickly as possible. So it's been a great partnership. So just by way of a brief bit of history, I'll be speaking about domestic violence accountability programming, which was formerly known as batterer intervention programming. And they are treatment programs which address the behavior of individuals who use violence in their intimate partner relationships. And they're most often delivered in the forms of groups that meet over a period of months. And the interventions really give the opportunity for people that are using violence in their relationships to replace tactics of coercive control with respect and nonviolence. And so it's meant to be one component of kind of the important kind of human services and criminal legal responses to domestic violence. But I do want to be clear that these are not services that are for victims. They're not victim services. They are services for people who use violence, and to Senator Lyons' point earlier, really aimed at changing the trajectory to prevent future violence or diminish the chances of future violence. And we have a robust history of domestic violence accountability in Vermont. There used to be a very significant infrastructure for these programs. And then in 2013, the Department of Corrections changed its treatment approaches. It had previously funded domestic violence accountability both in an incarcerative setting and in the community setting. And with those changes, eliminated funding as of 2015. And so as part of JRI 1 and JRI 2, there was an analysis of kind of charging and incarceration and recommendations from both JRI 1 and 2 that the state again fund domestic violence accountability and reinstate some robust funding for these programs. So as a result of these recommendations, we received funding in the FY22 and 23 budget. So currently there are 11 certified domestic violence accountability programs. They're certified by the Vermont Council on Domestic Violence. And in order to achieve that certification, these programs go through a really robust certification process. They submit their policies. There's community-based review teams that are multidisciplinary, involve state's attorneys, law enforcement, domestic and sexual violence advocacy organizations, the Department of Corrections field offices, DCF, and others. So in FY23, a total of $500,000 was awarded to support this statewide system of domestic violence accountability programs and advance several important strategic objectives that were actually outlined in some of the budget language. So of the total award, 70% of that funding has been allocated directly to those domestic violence accountability providers through a funding formula, which I'll tell you about in a moment. And the remainder of the funding is being used for data collection and evaluation, as well as some statewide coordination efforts. So just to kind of recap, a total of 500,000. There was 200,000 built into the base from JRI 1. Those were FY21 savings that were carried into 22, and then an ongoing 300,000 allocated last year for that total of $500,000. So just want to highlight a few brief objectives for you in terms of how we're using the funding. The first is developing a funding formula to eliminate participant fees. So the legislative language authorizing this year's investment required the elimination of participant fees. So because the funding had gone away in 2015, these programs had been sustaining solely on charging fees to folks that were completing the programming. And it's long been our position at the network that funding based on participant fees isn't sustainable, nor is it equitable, and kind of counterintuitive to the other work that's happening on criminal justice reform. So as of October 1st, these domestic violence accountability programs will no longer be charging participant fees. And a funding formula was devised to allocate the funding out among the existing certified programs, which uses a base level of funding for each of the programs, with additional funding distributed based on the percent of groups that each program offers. So essentially based on kind of their market share of the total number of people being served. And currently the available resources, the 500,000 that we received this year, is pretty much just sufficient to ensure the existing 11 programs are sustainable without participant fees. So as we continue to expand offerings to meet the needs of communities and the demand of the courts reopening, I just want to note that there is likely a risk of diffusing the funding to the point where the existing programs aren't sustainable without fees. So we're going to be monitoring the impact of the elimination of these fees throughout this year's implementation, and we look forward to kind of continuing conversations about that. The JRI funding is also being used to significantly improve our data collection and our efficacy evaluation. So in 2023, the domestic violence accountability providers will transition to a database to track data at the participant level rather than at the kind of program or group level. And this data is now a condition of funding for certified domestic violence accountability programs to allow us to more concretely measure how effective that programming is. And the network's also working with the University of Nebraska to develop an evaluation framework and to conduct an initial assessment on the elimination of those participant fees. And the last thing I want to highlight for you is that one of the statutory mandates of the funding was also to ensure the availability of domestic violence accountability programming for the LGBTQ plus community. Programs that address the needs of violence within LGBTQ plus relationships are few and far between. It is new to the field of domestic violence accountability programming. And so we are working with the Pride Center of Vermont outright, out in the open, to develop a strategy for specific responses to domestic violence. And in the interim period, we have 3 existing programs that have signified that their readiness to transition their group models to programming that's inclusive of people of all gender identities or sexual orientations. So we'll be working with the National Center for Court Innovation and a few other technical assistance providers to build capacity within Vermont around that transition. We are also using some of the funding to pilot culturally specific or community specific needs. And so some of those examples include some work that we've been doing to develop some programming for the migrant community in Vermont and violence that happens there, as well as programming that's specific to parents. So we've been working with the Caring Dads program in Bennington County to expand their offerings or similar programs for parents where there's violence in a household. So I would be happy to answer any questions that you have or talk at greater length about any of these pieces, but I just want to say that we're thrilled with the investment and very grateful for the continued support.
Thank you. We do have questions.
Just a quick question. Thank you. It sounds like you have a lot of plans for that 500.
Yes.
And my question is, do you have numbers of people who are being served?
Yeah, absolutely. I can get that to you. We are collecting that data currently. We collect it on the kind of group level, so we don't have, where we're moving to is being able to track outcomes for individuals to kind of measure efficacy. But I would be happy to follow up with some specific data on the number of groups and the number of individuals in those groups.
And are these individuals sent to the program?
Great question. All the programs are open to self-referral. As you might imagine, that's quite rare. But the majority of the referrals come from the Department of Corrections. They also come from the Department for Children and Families when violence has been identified as something that's happening in a family, but there may not be kind of a criminal component that is progressing. And courts can also mandate individuals into treatment.
Thank you.
Yeah.
And I think part of the thinking of paying for the fees was to get more folks into the program. And that was one of the discussions that both Corrections and Institutions Committee had with appropriations. And that was our recommend to approps that some of the money be targeted to paying those fees instead of having the offender pay the fee.
And
help more folks come in.
Yeah, I think Vermont can be really proud to be in a very small number, but growing number of jurisdictions that are eliminating participant fees. There have been several studies that other jurisdictions and states have done on participant fees and the barrier that poses. As you might imagine, these are individuals participating in this may still be in relationships with victims themselves. They are parents. They are disproportionately low income individuals and people of color. And so we do think that eliminating participant fees is an important equity measure.
Lisa?
Just a quick question. Who are the providers of these services?
Great question. So these 11 certified domestic violence accountability providers range from mental health agencies. There is a program of a community justice center that as kind of part of what they do, they offer domestic violence accountability programming. And then there's also individual kind of therapists that have developed these programs and offer those services in their community.
And so with the 11 certified programs, is it available statewide?
It is, yep. So there are programs that serve every community in the state of Vermont. A lot of those programs are operating in either online or hybrid options as well. So one of the great things is that as the courts have opened, some of these programs are small and have more limited capacity. And so we've been able to refer folks into programming in alternate areas because the programming is offered online.
Okay.
So yes.
Thank you.
Available everywhere.
Any other questions?
Thank you.
Okay.
Great, thank you.
Yeah, thank you so much.
So one more item, and this is with the Department of Mental Health. And we have with us the Interagency Planning Director, Cheryl Wilcox. Welcome, Cheryl. And I know that I believe Patricia Singer is also with Department of Mental Health. And on our list right here, there's indicated 400,000 was appropriated to the Department of Mental Health for Justice Reinvestment 2. That was done in your FY22 budget. And the goal was to beef up mental health services to folks who are reentering from an incarcerative setting, for sure, but also dealing with folks under jurisdiction of DOC that have reoccurring mental health issues. So I will turn it over to you, Cheryl, and if you could just identify yourself for the record.
Yes, hopefully my audio is working well and you can hear me. Cheryl Wilcox. I'm the Interagency Planning Director with the Department of Mental Health. I'm actually joined by two of my colleagues, Patricia Singer, who is the Adult Services Director here at Mental Health, and Annie Ramnesino from Department of Corrections, who is the Executive Director of Mental Health and Addiction Services. So there with me in the event that you have more questions about the program that I will describe that we have stood up with these funds. So they're here in case you have additional questions. So I think to Senator Sears' earlier point about these funds being used to stand up services that wouldn't otherwise be available, we've taken that seriously. We're really appreciative of the funds that got put in our budget. And when the funds got allocated last year, we started having discussions and meetings. This actually is an interagency effort, as you probably guessed, based on my title. So it has been with the Department of Corrections, our Department of Mental Health, and also at the Department of Health in the Division of Substance Use, which was previously known as the Alcohol and Drug Abuse Programs, ADAP. So it's been an effort with all of us looking at how we can stand up programming. There is a grant now that's been executed with Pathways, which exists in Burlington. They're a specialized service agency providing mental health services. They have a 2-year grant. It's for more than the $400,000 we were allocated, because in looking at budget and numbers and needing to hire staff, and also taking into account inflation and the cost of workforce and the workforce crisis we have, we wanted to make sure they had enough funding to really be competitive with wages. And so Annie Ramnesino from DOC also made a proposal that was approved through our Mental Health Block Grant Planning Council for an additional one-time $200,000 to combine with these funds that you all allocated, so that Pathways would have enough money to ramp up and have some sustainability. So our plan at this point, the grant actually got executed July 26th of this year. It took some time based on getting the allocation and then the interagency collaboration, making sure we got the amount of funds we would need to make sure this was sustainable for Pathways. So it took some time to stand that up. But the grant is executed. It's for $1 million. That's the total. It's for a 2-year time period. We have performance measures and other data we'll be collecting. And the program is an evidence-based model that hasn't existed in Vermont called Forensic Assertive Community Treatment. And so it serves individuals who were incarcerated with the goal of trying to help them in the community so they don't become incarcerated again. So our Burlington probation and parole folks will make the referrals to this program to Pathways. We had our first quarterly meeting with Pathways since the grant got executed, as they're working to staff up. And the plan being that we'll continue to have those meetings and also to really look at the effectiveness of this over the next 2 years so that we can determine moving forward with this. I think it is rare that we get funds such as this to be able to stand up new programming, and we want to make sure it's effective and we use these funds in the best way possible. So that's the way we proceeded and the funds that we combined. And again, if there are questions about the programming, we can answer that as well. And I see there's already a question.
So Senator Sears.
I have 2 questions. One is, could you explain better what you mean by forensic group? Because, as you know, there's a separate issue regarding those forensic patients and what to do about them. Secondly, am I to understand the $1 million is only for Burlington, or is it all of Chittenden County, or is it statewide? No, Pathways is in at least 7 or 8 counties now. So will it, that I just want to understand specifically the $1 million.
Yes.
Geographic, because the next item is geographic consistency.
Yes. So this initial grant is for Chittenden, the Pathways that's in Chittenden, for them to stand this up. And Annie, I'm actually wondering if you could speak more to the forensic and the community piece, because Annie has a great deal of expertise in this realm.
Hi, for the record, my name is Annie Ramnesino, and I'm the Department of Corrections, Addiction, and Mental Health Systems Director. I just want to thank the committee for being curious and inviting us to explain how we're allocating these funds and the very exciting process and progress that we're making. So this has been allocated, as Cheryl just said, to the Burlington Probation and Parole Office to serve clients throughout Chittenden County. The forensic piece of assertive community treatment, we are defining as people who are either on community supervision or reentering into the community from the carceral environment. The critical criteria for the probation officers and for our team, our internal DOC team, in examining who is eligible is that they must have a serious mental illness. That is tied to both the mental health block grant funding that we are receiving that Cheryl mentioned, and also is a critical component of ACT itself. So it is, as Cheryl said, has about 40 to 50 years of evidence-based research behind it as ACT alone. And we are hoping to add to the national data of efficacy using it in a forensic setting.
Thank you. That explains to me everything I need to know.
You're welcome.
I'm just concerned about going further away from geographic consistency as we offer programs that are not available to all Vermonters and only a specific few. I can tell you Bennington has forensic problems.
Yes. So, I mean, we are very, very sympathetic and are completely in agreement with you, Senator Sears. And I think, overall, the very large picture here is that we have a very robust evaluation already developed. And I would add that there's a fourth partner in the mix, and that's our Medicaid agency, DEVA. The department has a longstanding MOU with DEVA in data analysis, as you know, in my previous testimony, specifically in my lane, that's been around medication-assisted treatment and the evaluations that we've been conducting. And so we will be partnering with them as well to be doing longitudinal studies of the individuals who are in fact and have received fact services to again look at reductions and savings across all of healthcare. We'll be looking at emergency room usage and utilization, deterring people from seeking the most expensive care because the preventative care will be in place and will be wrapped around them.
I'm not criticizing the program or the plans for the program. I think Pathways does a terrific job. I hope we can get a better understanding of all the funding going into Pathways, but that's a different subject. My concern is, and it's one that Representative Grad and I have tried to deal with during our tenure as judiciary chairs, is the geographic inconsistencies around the state and what services are provided, particularly to the offender population and the criminal justice services. And this is one more example of a program that's not available. And I could go on and on, drug courts, mental health courts, etc.
No, I agree. And I guess what I sort of lost my way in my comments was that we're really hoping to prove that this is really, really effective. And we hope then to bring the business case forward for it, that it should be statewide.
Thank you.
So Teresa and then Jenny.
I was just going to make a comment. It just sounds like this is a pilot program. And then to have it diversify, go across the state, not diversify, but move across the state.
So my question is, how are people referred? Is it a self-referral? It is we heard several different sources of referral in the previous presentation. How do they access the services?
Cheryl, do you want me to take this?
You go right ahead, Annie, yeah.
Okay. So as I said, the driving criteria is serious mental illness as is defined by the federal government and SAMHSA. And so we will be looking at individuals who meet that criteria, and it's going to be voluntary. We're going to be offering this as a specialized service with informed consent processes. We've already developed these scripts for probation officers when they meet with the individuals. And we're going to be hoping that people are willing and interested in staying in the community and decreasing the risk to victims. And really, we're going to be encouraging them to invest in themselves. This is going to be a very new style of supervision, where our intention is to have very, very flexible community supervision surrounding and wrapping them as well, working in a very strong multidisciplinary team that has daily meetings. And we have confidence because we've already been sort of putting our toe in the water, if you will, with the complex care project that preceded this, where we partnered with VCCI and others to provide a better wrap on physical health care and mental health care and substance use through VCCI's assistant. And so we think that there's going to be a strong uptick, and it'll be a group process in selecting these individuals. But again, SMI, serious mental illness, and then the person will need to consent to this style of supervision and support.
And so it sounds like that they'll essentially get referred, even though it's voluntary. I'm understanding the voluntary and the SMI criteria, but they'll be referred through the PMP office, it sounds like.
Yes.
Okay.
Essentially, yes, and also through reentry coordination from the prison system.
Okay.
You know, we will be tracking these individuals. There will be in-reach that's also built into the grant with Pathways, that once they're a client, they're always a client. This is a longitudinal, long-term support system. And so if they were, let's say, spinning this case scenario, reincarcerated because of the risk they pose to the public, we would be requiring Pathways to be doing in-reach with them to support them while they were incarcerated, and at least 6 months before reentry back into the community. And they can obviously stop the program and return to regular community supervision if they're in the community. But if they choose to, they will be receiving and can receive these supports until they are no longer in our custody.
Thank you.
So we are running over on this particular topic. I know we have folks here for the CJCs, but I want to finish this with our joint fiscal office to indicate how much we're projecting for the FY22 bed savings that will be applied to the next budget cycle. But before I get there, Maria, you can come on up. But before I get there, I just want to be clear on these dollars. It was $400,000 that was appropriated in FY22 to DMH to beef up, to provide some services to the offender population. You've used that $400,000 plus an additional $200,000 towards this pilot project with Pathways. So that additional $200,000, did that come from DOC budget?
The additional $200,000 is through our mental health block grant.
Through the mental health?
It's one.
Okay, so you said it's also $1 million. The contract is $1 million for 2 years. So where is that additional $300,000?
It's from our base budget at DMH.
Okay. And I ask this question because it's a pilot project for Chittenden County, the quest for 2 years. Our question is going to be, do we provide another pilot project in another county? What is the cost? And if it's $1 million in Chittenden for 2 years, and basically half of that 1 million, more than half, came from ongoing funding from DMH or a grant from DMH, where does that leave us to make any recommendations? So I asked that question specifically in terms, how do we move forward with this pilot project or not? Knowing what the cost is. Any further questions from the committee or folks on the screen? So with that, I want to shift to Maria from our joint fiscal office so that she, and I hope folks can stay on the screen, depending what questions may come from committee members, but to give us what is being projected for costs for the out-of-state bed savings that occurred at the end of the FY '22 budget that will be applied to the FY '24 budget for justice reinvestment.
Okay, thank you. Again, I'm Maria Bellavoe from the Joint Fiscal Office. And I have a document, but I don't know if you all have it as well.
We have it on our webpage, but I'd like a hard.
Okay, so here, I'll pass them around. This is a document that we received from Richard Donahue, who is the finance director for the Agency of Human Services. And I have it for everybody in the room. Is it on, did you say it's posted?
It's posted on our website.
The same document. Okay, good. Okay, so when you look at this document, you'll see the first 3 lines reflect what you've already been discussing. And that was the amount of money, the total of 777 that has been appropriated in the budget. We already talked about that. But on the bottom, the amount of money that they're projecting, or no, I'm sorry, that is available at the end of fiscal '22 is this $1,982,246.88.
Is that on top of the 777, or does that include the 777, the 1.9?
So I believe, and we do have people from corrections here, that is in addition to the 777.
So if it's in addition, is that 1.9 million plus what we as Justice Oversight Committee need to make a recommendation on how that gets allocated?
Yeah.
That 1.9 million plus is on top of your current base budget of 777,000?
That's correct.
That's one of the largest chunks of out-of-state bed savings.
And part of that, I think, is a reflection that there are fewer people out of state. And so as we draw folks back and don't send new folks out, that savings will increase. I mean, it did increase this year. We're down, as you'll remember, Representative, I think when I started in this job, our number was around 145 out of state.
Mm-hmm.
As of this morning, we're at 117. So in a year, we had a fairly significant reduction in the population.
But that will level off, I would think.
And I think we're about at that number for the moment.
So that's a big chunk of money. And so we've laid the foundation here for our conversation as Justice Oversight in terms of what our current community partners are providing. And I think at our next meeting in the September 28th, we really will need to spend some time on what we recommend for this. And it's only a recommendation from this committee. It will go to our appropriations committees for further work. It doesn't mean it will be included in the governor's recommend for their FY24 budget. Governor could make a totally different recommendation for the use of 1.9 million, but 1.9 is pretty substantial.
It is.
That, so we really need to know what's occurring right now and where do we want it to go. And I think this really reflects the importance of what Senator Sears was saying of tracking the cumulative savings and knowing we have a base budget. And that's what fed into having a line item for justice reinvestment too in our budget, so we can track this. Questions? Thoughts? Thank you.
I can think of a lot of places to send it.
Well, can't we all?
I think we all can. The question is, do we keep what we already have and beef them up?
Exactly.
That's why we're gonna spend some time at our next meeting on the 28th, while this is fresh in our minds. Try to grapple with this. So I know we have a heavy morning. We're running behind. I want to shift gears and go into our restorative justice. If you need to take a break, take a personal break. But thank you, folks who participated this morning on the Justice Reinvestment. And I know we broached subjects that dealt with our community justice centers. And I am going to turn it over to our legal counsel, Ben Obrowski, to kind of give us a really quick, broad scope of our restorative justice. And also one piece that we really wanted to focus on that came from our conversation last month was, again, if you go back to last month's or July's meeting, our documents, there was a document that came through, I think it was put together by our justice, by JFO, but I'm not sure. State-funded community-based restorative justice programs. And on the very back piece, it was a sequential intercept model of criminal justice. It talked about our justice centers, our court diversion. And we wanted to hear which counties use this and how effective it was. And also, we wanted to get an overview of how our justice centers, restorative justice initiatives are funded, and also where the geographic consistency is with it. So this is a very broad discussion. I know we're running late. We're probably going to end up going to 12:30, so our lunch is going to be postponed a little bit. But this isn't the first time we're going to be talking about this. So Ben, I'm going to turn it over to you.
Yes, thank you, Chair Emmons. Ben Oversight from the Office of Legislative Counsel. I will try to make this as brief as possible and coherent as possible in that brevity. So just a point of information, the state-funded community-based restorative justice program sheet, I believe that was provided by Jill Evans, who's the director of the Essex Community Justice Center. And basically, I'm tasked with giving an overview of what the statutory structure that drives restorative justice programming in the state is. And in a phrase, it's been the byproduct of an evolution over the last 30 plus years or so, and lives in various titles within the Vermont statutes. And as a result, it gives some flexibility to be responsive to community needs in each respective community, but also provides inconsistency in the services provided in those communities as well. So, for instance, I think something that is emblematic of that flexibility is that a community justice center itself can be a facility, but oftentimes it's referred to as the programming that's associated with community justice centers. So a facility isn't necessarily all encompassing of what a community justice center programming provides. And what that can look like is that it's really dictated by three agencies: the Department of Corrections, the Attorney General's Office, and the Department for Children and Families. So starting with DOC. DJCs are housed in our statutes under the authority of 24 VSA Chapter 58. And this is one of more than a half dozen titles that govern the programming often associated with community justice centers. So starting with Chapter 58 of Title 24, essentially this provides municipalities with the authority to create a CJC within its jurisdiction, or to designate an organization to act as the CJC, which is oftentimes a nonprofit. It also empowers the department to use a variety of community-based restorative justice approaches and programming, including restorative justice panels. And I'll speak a little bit about that in future, but essentially those were part of that evolutionary process over the past 30 years. And that's how they are one aspect of that variety of services that DOC can provide. It's also empowered to implement programs to resolve disputes, address the needs of victims and wrongdoing of offenders, and to promote the rehabilitation of both youthful and adult offenders. CJCs are empowered to train their volunteers in restorative justice programming and processes. It provides informational and education resources to their communities. And it also, this chapter provides the authority to apply for funding from governmental sources, like the legislature, private foundations, or other sources. Some are funded, some of their funding is supplemented by the municipalities that they're located in, like Burlington. It also mandates coordination with AHS and other sort of information sharing practices to ensure that I think that there's an understanding top down within the agency and the department. To give that background, prior to 2008, when these CJC statutes were sort of housed in Title 24 in one singular fashion, restorative justice programming and services were governed by a series of statutes that charged DOC with the administration of these restorative justice initiatives. One such statute was passed in 1989, which authorized grant programs for community-based halfway houses and programs. That's found in Title 28. It also created an Alternatives to Incarceration Board, which was created to receive and award grants in addition to monitoring the progress of funded programs. In 1999, restorative justice programming expanded under the DOC. It created a state policy under Section 2 of Title 28 that essentially empowered communities to respond to a person's wrongdoing at its earliest onset, tailoring the sanction based on each circumstance. Implementation of the policy required law enforcement officials to employ restorative justice approaches in court diversion, sentencing, and with individuals under supervision of the DOC. The commissioner of DOC is empowered with the authority to establish reparative boards and to delegate authority to community boards and justice centers. So as the next stage of this portion of the meeting is going to touch on that sequential intercept model, this is one of the authorities that kind of lends itself to or empowers that model to occur. One, you will see direct referrals from law enforcement within that model. You see direct referrals from prosecutors and also referrals from the court themselves. And then also within the Department of Corrections after sentencing. So again, this is one piece of the larger pie, if you will. Again, in Title 28, it was expanded to bring community reparative boards under the supervision of the Commissioner of DOC and created structure, procedures, and membership requirements of those boards. So that's an attempt at a summary of the DOC's role when it comes to community justice centers and restorative programming initiatives. But there's also the Attorney General and DCF. So the Attorney General's program is found through a series of statutes in Title 13, Title 3, Title 7, and Title 18. A lot of the programs associated with the Attorney General's are the diversion program, Tamarack, youth substance use awareness safety program, and the civil DLS program. So for instance, court diversion in Tamarack is found in Title 3. The juvenile court diversion program is also found in Title 3. The youth substance and safety awareness program, which really provides an alternative to civil adjudications and fines for 16 to 20-year-olds for violations of various statutes, including the possession of alcohol, possession of small amounts of cannabis, the distribution of small amounts of cannabis, and then again, the civil DLS program. Within DCF, there's the Balance and Restorative Justice program. This is not is found in statute expressly. This is really a contract-based program that was started in 1999 to provide these restorative justice services for youth. It contracts with providers to offer case management services, restitution services, screening and restorative services, and classes and skill development, among other services. All of these programs are funded in similar ways through grant programs, which we've heard a little bit about today. And, you know, really the conclusion of all of this is that the evolution of laws and the current structure provide CJCs with the discretion to achieve the restorative justice goals, be it through a singular facility or through a conglomeration of services that are either housed in that facility or offered by other providers. This flexibility, as I began with, gives communities flexibility to respond to their community needs, but also inherently provides a difference in the services provided. So while you may go to the Burlington Center and get a suite of services because that houses really all of the programs that the AG, DCF, and DOC provides, you can go into one in, I believe, by way of example, in Windsor County, where the DOC programs are offered through the Hartford Community Justice Center, but the DCF and AGO programs are offered through Valley Court Diversion. So again, you know, one person that may be looking for these suite of services, if they use them in Burlington, it can be a one-stop shop. But if you go to Windsor County, there are going to be different providers in different locations providing those services to those people. So
thank you, Ben. I mean, people have been trying to get a handle around our restorative justice system. And the more you do a look into it, the more complicated it is, and the harder it is to follow the money, and the harder it is sometimes to follow the services. One discussion that did occur on the House side with some folks is really looking at cleaning up the statutes because they were added on in a hodgepodge manner over the years. And that is a monumental task to do that. So the thinking is, well, let's take a look and see if we can come up with some recommendations on how to move forward in this world of restorative justice that includes our community justice centers, but also includes court diversion and includes the BARJ program within DCF and then our funding streams. Lisa.
I'm trying to recollect from our charge under this. One of the things that we're supposed to be evaluating, I think, is whether we have geographic equity across the state for all of the different components. And when I take a look at the information that was both what Ben was just talking about, but also the information that was provided to us last time, sort of that color-coded chart, when you look at, there's like 8 different components, and each of the counties has access to all 8 different ways. But I guess, you know, ease of access might be a question, but it seems like in all of the counties across the state, they have access to all of the services. How easy that happens for people is maybe a different question, but I just am, you know, trying to think about our charge and whether or not we, you know, see a way to improve that or not. But it seems pretty clear from the color-coded chart that every county has access to all services.
So we have all of our partners here today with us. We have DCF, we have DOC, we have the Attorney General, we have the state's attorney, and we have the courts. So we have all the players, and that was one of the questions to really focus on this piece and to get an understanding of what each of their individual roles are and how that plays out across the state and the counties. So I'm glad that Teresa brought this up because our charge is to study the restorative justice programming and services, which includes the administration and funding of pretrial services, court diversion programs, balanced and restorative justice initiatives, and our community justice center services. We need to consider strategies for ensuring geographic consistency and equity for restorative justice programming and services. And we also need to make any recommended changes to streamline the restorative justice program and services that coordinate the roles, responsibility, and funding of DOC the Office of Attorney General, DCF, and any other entity that administers restorative justice programming and services in the state. So it's a heavy lift. This is the first real time we've had to focus on this. So we've got our partners here in the room. I think today we really look at this sequential model, the sequential intercept model, and really figure out how each entity is working in this and where it's successful and where it is. Does that make sense to folks? Ben?
And just a point of information on this, this visual here. This is the sequential intercept model that is really indicative of one of the 8 programs that I briefly summarized. So this is for restorative justice panels and the different touch points of referrals for those panels. So it's not don't take this model and apply it across the board to the various programs. This is just really an illustrative visual.
You got to start somewhere, right? So with that in mind, because the committee did state at our July meeting, we wanted to know which counties use these systems here. That was the question. So I'm going to start just with a list of folks who are identified as testifying. I'm going to go in that order. I'm going to start with our state's attorney and sheriff's department, John Campbell. John, come on up.
I'm filling in for Evan being today.
Okay.
Busy back at the office.
So welcome, and if you could just identify yourself.
Yes, thank you. John Campbell, Executive Director of the State's Attorneys and Sheriffs.
So are you clear in what we're looking for?
Yes, I believe I am. And, I think it'd be better, I can answer some questions, but the model, the sequential intercept model, when describing what the state's attorneys do, I don't think it's the optimum fit to see what we do in the process, because let's say with diversion or any restorative justice, we can make that decision at any point to divert or to offer restorative justice to a defendant from any time after filing the initial charge, all the way up until trial. So in other words, we may have somebody that we do not offer diversion to originally based on wanting to see if they'll take part in a substance abuse program, or if they take some steps that show that they are taking this serious, then one of the state's attorneys may offer them diversion or another restorative justice program. As well as there are many times when the charges don't even get filed that we actually will refer them to community justice programs prior to ever filing to see if they'll do that. And so it does. We just had our state's attorneys meeting, all state's attorneys meeting, and there is not one policy across the board. It's just, you take the individuals as they come before you. Because my personal belief is that the criminal justice system is designed to take defendants and look at them as individuals and make a decision based on what the facts and circumstances of the acts that they committed, and try to work with them and to come up with a program that we feel would benefit them and the folks that have been the victim of these crimes. So
we do have some questions. Jen?
Yeah, I do. I mean, this continues to be a question that is in my mind about coordination of state's attorneys and how they work together, particularly in a situation like this. And knowing that it's the Attorney General's office that's actually more engaged in what is going on with CJI. Do the state's attorneys look to the Attorney General's office for guidance and sort of direction about when and if and how to make decisions about individual needs? How do the state's attorneys access and utilize the mental health or other counselors needed to help make those decisions. I mean, it just feels always to me as if that it's so idiosyncratic that it could be frustrating to someone who's in this kind of a system and not knowing that, well, golly, Ned, I could do this, or I could do this, or, so just, can you talk about that kind of the perspective of whether it should be coordinated or not?
Let me get back to the AG in a second, but let me just say this. The how we've dealt with people who come into the criminal justice system, when we design it on paper, it looks good. You know, we're supposed to have this, you're supposed to be able to interact with the individual, and you're supposed to, you know, try to find out what's best for them, which I earlier said. But unfortunately, I mean, now we're like with even the case backlog, and that is not just from the pandemic. There's a lot of reasons that go into case backlog, which is for another discussion for another day. But it takes away from that person, from that who's sitting there and looking at the paperwork saying, okay, here's a crime that was committed. And here's the individual. We don't have the time that we used to have to where you could say, well, yeah, you know, that's Joe Smith and his parents, you know, they divorced early and his father was an alcoholic and had all this problem and that problem. You don't get to have that time anymore. It's not, the luxury is not there. And it's, you know, I shouldn't say it's a luxury, but it's something where I know that many of our deputies and state's attorneys have said that it is frustrating that they don't get to work closer to find something that will work. Because what you're going to see in diversion, that people, if they've been through diversion before, the recidivism rate is high, and they're going to be coming through the door. It's just a revolving door. And if you go and look at any dockets like Rutland County right now, I think Judge Zone and I were just talking about this. If you look at that calendar, I assure you, you're going to recognize names for not just, you know, the same name over generational names. And you're going to see the individuals continuously because of the fact that they don't comply, they don't do what they're supposed to do. And so that's frustrating where you're not able to do it. The other thing is that while we'd love to have everybody be the same and everybody be afforded the same services, and as Teresa, as you said, they're all the counties, they have these resources available, but not every resource is the same. And not all the people, not all the personnel. There are ones that are, you know, they're a department, or I shouldn't say department, but like agencies or that groups that offer these services that they're inundated. And so they lack the time to be able to give it. Even our defense bar, they have the same problem that we have. Sometimes they're not able to spend enough time with their clients. And I guess I'll let defense bar talk about that. It seems to me, in my experience, that they don't have enough time to talk and try to find something that's going to really work. And so we're trying to, I think sometimes we try to make, you know, a cookie cutter in a way, or something that, oh, this is going to work. When you're dealing with a system that is so different and it comes up with so many variables and they're thrown at you at the last minute, sometimes that it's hard for you to just put an all size fits one. And get to the AGs, I should get to that. So I'm getting older and I forget the questions. But Willa Farrell, who's here today, she'll be testifying. She does a great job for the AG and trying to put the whole diversion program together. And we are actually have been charged where we're to work with the AG's office to try to come up with some criteria for doing diversion. And, you know, we have not completed it. In fact, I'll be very honest, it's been so busy in our office, what we're doing and the resources, it has not been accomplished. I know that Evan and Willa are planning to discuss it further, but even that, I think we need to be able to get some ideas, some criteria, but I don't think you're going to be able to just say, here's the absolute, you got a 1, 2, 3, you got to check these boxes, and then you automatically go to diversion. It's, and unfortunately, the state's attorney is the one who has a lot of the information. Like the court won't have the information about how many times this person might have been through diversion. And there are times when now also with the expungement law that once somebody completes diversion and they've completed successfully, those records are gone. So we don't have that data. So it's hard to take those other matters into consideration as well.
So we have a couple more questions. I'm going to go to Butch and then Senator Sears.
Thank you. I think Senator Lyons asked you a question within there. Do you consult with the AG's office to try to get all of your state's attorneys all on the same page, practicing the same practices? And am I paraphrasing that right? Or, yeah, and I don't think I heard that answer other than maybe.
The answer to that would be, I'd have to add, we'd have to dig back down further because there's a lot, are we talking about just diversion decisions? Are we talking about charging decisions? Mm-hmm. And the answer is really no. The criminal justice or criminal division in the Attorney General's office over the last 4 years have changed drastically. I wish that they were here today, which Domenica was here, she explained, but they've had a different mission. It's not the same, and where there'll be times when they will take a conflict case, or if there's a matter that's one that's going to require a lot of extra resources that our departments don't have, then we would call them. But there's nothing to where we look to the Attorney General and say, Attorney General, you tell us how we're supposed to do our job. I think that, I don't think it would be a good idea. I think that, the state's attorneys, again, each one of them are in different counties. I can tell you Chittenden County is far different in their approach than, let's say, Northeast Kingdom or down in Bennington or Wyndham. And there's different crimes. There are different individuals who commit these crimes. And you have to really, I think, see the whole picture in order to really make the decisions that are required.
And that's a conversation we've been having in this room for years. Mm-hmm. I'll paraphrase it as geographic justice. And do you receive the same treatment in Bennington County that you may or may not in Chittenden County? And I think that's been for me, that's been an issue that maybe not. And maybe we should wait for Willa to come up and.
Yeah, but I can just say from my perspective, I agree. I don't think that you are going to see that everybody gets the same treatment from county to county. Let's go to Chittenden again. Chittenden has a lot of resources. They have a tremendous support system, like with mental health, whereas you're not going to see that in the Northeast Kingdom. You're not going to see it probably in Orange County. You'll have some, but they don't have the same type of resources. So when we're talking about the geographical diversity and the geographical challenges, it's not just the state's attorney, it's not the person who prosecutes or decides to prosecute. It's also taken into consideration what programs are available, what do those programs have to offer? Do they have the personnel that are qualified to provide the services? Does it, it's also you take into consideration the judiciary, and because you have different judges sitting there on the bench. You have defense attorneys. There are some defense attorneys that work really close with the prosecutors to try to come up with some alternative methods to use. And there's some that either because that's just not the way they operate, or now it's mostly because of the fact nobody has any time to really go out there and design a good program for each individual person.
Okay, and I'll figure that one out.
Well, no, go ahead. I'm sorry.
No. But you said earlier too that you can intercept any of these cases at any point along the way. Where do you stop being able to intercept it? When it gets to court sentencing, or can you?
I think we're going to get ready to trial.
When it
get to trial.
When it gets to trial.
Yeah, right up to that point.
Okay.
Then they can make that decision.
And that's your plea bargain.
It's a lot. I mean, there's plea bargains. There's different things.
So you have a lot of leeway coming up through until they walk out
yes.
the door.
And if you take that flexibility away, I think you really hurt the person, the individuals that are going through it, because you may get some angry person who commits a crime, and then all of a sudden, they realized my life's going down the toilet here. I need to get my stuff together. And they do. I mean, we don't have failures all over. We have a lot of people that are successful in trying to clean up their act or to change their behavior. A lot of people who get off drugs. And so therefore, if it's limited, if we don't have that flexibility, then you're not able to identify work and say, yes, this person deserves that shot.
Good. Thank you.
So.
Senator Sears?
Oops, thank you, John. Butch asked some of my questions, so I'll try to make it as simple as possible. I recognize there's differences in culture and differences in state attorneys, even differences in judges statewide and how they approach the criminal justice system. But we have a restorative justice or diversion-based programs that are not equal in terms of what they offer. And it's very confusing. You know, one of the problems is the different funding sources. Why do we have these programs through the Department of Children and Families, Department of Corrections, and then the Attorney General's office? Seemed like it'd be administratively a lot easier if there's only one. And then you have the various offerings. And so I think what we're trying to get at is, does somebody from Bennington have an equal shot at services if they're deemed to be appropriate for those services? And that's really the simplest way I can put it. And, you know, throughout statewide, wouldn't it be simpler to just have one organization running and one set of grants by the state? We're not a big state to have 3 different departments involved. And then you see in each state through this, what we've been given is what services various what are offered, and also who's offering the services. So it gets very confusing. And, you know, I just use one example. If you're in Bennington, you can't get methadone services in Bennington County. You have to go somewhere else, either Rutland County, Windham County, or North Adams or Berkshire County, Mass. So you can't get that in Bennington County. So our state's attorney in, you know, dealing with that has to make a different consideration. Should that person even be able to go? What would happen to them as they go to Rutland? Will they continue? So forth. So it's kind of, how do we set up an equal system, at least that the services are available, as well as consistency in terms of administration and in terms of what the restorative justice programs can offer.
You know, it's interesting because, again, this is a problem we've dealt with, as you said, for a long time. And I think the first thing that
maybe I should ask, if we were starting over, would we develop a system as disjointed as this?
Yeah, I think the first thing you need to do is find out what's there. You know, what services are there to offer? Because, you know, it's interesting. Again, we have, you know, TJ up in Chittenden County, he's the one who started the Tamarack program. And, you know, if we had said, you know, you have to go through the Big D diversion, you can't get anything else alternatively, we never would have Tamarack. But that's because, you know, Chittenden County had some unique opportunities. They had people that provided those kind of services that worked out. So I think what we're doing is, and I agree, and there's not, this isn't the only place in state government where you have 3 or 4 or 5 different silos that are doing, you know, probably doing the same thing or trying to do the same thing. But if you want to deal with this issue, we know identify the problem. The problem is how do we get people into some type of restorative justice, and then, you know, what's the best way to deliver that service? But if you don't know what's available across the board, you don't know whether it's equal. You know, so you're saying you don't have a methadone clinic, Senator Sears. That's correct. And so we should say, all right, so if we're trying to deal with issues with people who have a drug dependency, and they're offered diversion down in Bennington, but we know that if they don't get methadone or access to methadone, the chances of their success are probably far less than it would be in Chittenden County or Rutland County. So, but until we really identify that, and it's not easy, because I'll tell you, I try to do it within my own department and ask them, you know, everybody give me a list of who you all work with. And they say, well, we can give you a list of the programs, you know, the names of the programs, but they change all the time. I shouldn't say they change all the time, but they change because of their own resources and what's available to them. There are waiting lists to get into places, like Washington County Mental Health locally here. I mean, I believe that they have a waiting list of close to 400 people right now to get in to get some basic mental health services. That is abominable. I mean, that is, it should not be occurring in this day and age. But it does. So anyway, to get back to Center Sears, I'm sorry, I kind of digressed there, but the point is that we need to identify the services and then figure out, once you have that, figure out who is best, which department, or whether you create a separate one that takes it all themselves and somebody that would be capable of actually ensuring or working towards the quality of services throughout the state. But I think that, God bless you, the first thing is that you need to identify what you have, because if you don't know what your inventory is, then you're just kicking rocks.
I think that's what we're trying to do, is figure out what we have. For that.
Yeah. I don't know if that answers your question. I don't know where to look, by the way. I don't know where's.
Well, you just look at.
You answered my question, John, to some extent, but I think that what the question that is before us in some senses is, if you were starting from scratch, how would you develop the best system to deliver services, diversion services? For example, I just look at Bennington County, where there's one, but for as great a job as she does, Lisa does at the Bennington Restorative Justice Panel, she's searching for grants from 3 different agencies, state government. She's also looking for grants from the feds, blah, blah, blah. And the same is true all over the state. So, how do we organize this better?
So I think what you should do is, and I don't know who the person is to do it, but somebody needs to start making a list of what is actually available. Somebody in AAHS or something has got to have some clue. I'm assuming that most of these places are licensed or have some type of, if they're getting any kind of grants from the state or from the feds, there's got to be, they've got to have filed something. And so if you get that, and then this is not a short process by any means, but then I think what you need to do is get the individuals together and start figuring, can these services be provided in a more uniform way?
So it would, the state attorneys might be able to tell us who they access or who their clients are accessing.
We could give you, I think all of us could probably give you a list of ones that are available, but that still is one where I think you'd need to get all these individuals to tell us exactly, what services they provide, what's their backlog, what are their resources? Because if they're constantly out there with the having bake sales and with the asking for money from here and there, they're clearly not able to sustain, and they're not having a sustainable delivery system.
I mean, I think we have an inventory of what services are available. I mean, I feel like we have been given that. How they're implemented at the local level is going to vary, like it does for everything that we, Vermont values local control. And that's no different in this type of service than it is in education or mental health or disability services. So how it's implemented, I mean, I think that is the question of whether that's effective and efficient in each community. And we, over time, have given communities the ability to develop something that is sort of specific to their community. So while some of these offer all 8 services and programs, others of them divided up, because of whatever reasons that developed during that time. And I mean, I feel like our charges, all of these 8 things developed over time. We heard Ben sort of outline, the different periods when we, Tamara's developed, or, some of these other programs. And do we really need 8 different little slots with money and contracts? And I think that one of the questions for me is each one of these is going to have different funding sources. They have different grants. We have local folks trying to meet state requirements of 3 different departments, plus whatever private funding sources that they're having to search out, because I think it's pretty clear that we haven't, as government, haven't funded these sufficiently over time to do what it is that we're asking them to do. And, you know, to answer Senator Sears' question, no, if we were developing this today, we would not develop something that looked like this. And to me, the question is, what do we gain by changing it, or proposing to change it? And do we lose more than we gain if we make a proposal like that? Because I agree, we wouldn't develop something that looks like this. But I think, you know, we're going to hear from the different entities that are providing the services, the strengths of what they think that they provide. And probably some of the challenges they have as well. So I think it's how much do we upset the apple cart, so to speak? And how much do we continue and build on the status that we currently have?
I just know, you know, having been in state government for a long time, I used to always think, why are we, again, putting more building blocks on top of things where we know the foundation is shaky? Or the foundation is probably parts of the foundation, we have no clue where it is. We don't know where the infrastructure is. And I think that, unfortunately, and through no fault of any individual, because I think we've all had good intentions, but I believe that we have created a system that unfortunately has cracks. Mm-hmm. And, you know, there are times when you have to raise a building in order to build a functional unit and something that's going to work. And it's a tough thing and it's a hard bullet to bite. But if somebody doesn't do it, you guys are the only ones who can.
Yeah, I'm not looking forward to the next best program that we all think that we should add, that adds another color to this chart. Because I don't think that would be effective either.
Yeah.
I think this is a really good conversation. I'm going to move it along.
Yeah.
Yes,
But
get out of my chair.
I think one piece too we have to keep in mind, the world of corrections and restoring the harm was very different in the 80s than it even was in the 90s, than it is now. And that's why I think our statutes are so fragmented in terms of providing this restorative justice model. And that's why it's evolved hodgepodge over the years, because we've had this tremendous shift in the 30 or 40 years in terms of how we see folks who are connected with the Department of Corrections.
And I think that's resulted also in a feeling of helplessness from a lot of agencies, a lot of people in the department, a lot of people who are trying to do the right thing. We need to reinvigorate our war against, what's happening to our youth, to what's happening to our people in the state. And I'll realize that there is a potential to fix this and to accomplish the goals that we set out. But it's going to take a lot of effort, and people have got to really work together. We can't have these divisions that unfortunately have, divided us along the way.
Mm-hmm. So we're in the court system with the state's attorneys. I'm going to shift and go to Judge Zoning. And I know I said I was going to go down the list, but we're talking within the courts. And I'm looking at the time, and I did mention to the Commissioner of Corrections that we may put off their piece in this until after lunch, because they're going to be with us anyway this afternoon. So, Judge Zoning, welcome. And we just like a perspective from the judge and what you're seeing across the counties with different judges in terms of how they use the restorative panels and then how they use the restorative justice system as a whole.
I think so. Tom Zone, Chief Superior Judge. I was used to going alphabetically too at the end.
Well, I started backwards.
That's okay. I like that. If I could just comment on one thing, Representative Shaw, you asked a question about geographical diversity and geographic justice. I know Senator Sears has raised this issue during the session. I heard that term. I would note that if you look at the diversion statute itself, and Senator Lyons, you asked the question about do they consult with the Attorney General? Well, the statute at Title III, Section 164 sets forth that it says each state's attorney shall consult with the Attorney General and develop criteria for determining which offenses and offenders will be recommended for diversion. It then says, it actually uses the word however, the final decision essentially is the state's attorney. And so the system itself necessarily brings with it, again, statutorily, each elected executive branch state's attorney decides what in his or her county they believe is appropriate for diversion. And we do see differences across the state. In some counties, there's a much more robust use of diversion than in others. In some counties, that takes place when you look at the sequential intercept model at the early stage, pre-charge, before we even get into arraignment. In some other counties, you see a greater use of that when the case starts getting closer to that trial time, when the state says, okay, we'll send it to diversion now, or the attorney may be able to convince the prosecutor to do that. And so there is a wide variation on what we're seeing. And so I can't say, well, this is the way it's always done, because in each county, there's different views by the prosecutors. And as John Campbell said, the system is really individualized. And so you can have criteria, but how that criteria is applied to that specific individual, those specific offenses, the history and characteristics of that individual can lead to what this group and others may look at and say, well, that's disparate treatment. Well, maybe it's not, because we might not know everything that the prosecutor knows when he or she makes that decision. And when we look at what judges do, well, when the judges get involved in the sequential intercept model, it's when people come to court. And at that opportunity, when they're there for arraignment, we have pretrial services under 13 VSA section 7554C that the legislature adopted. We can, at that point, bring in services for individuals with mental or substance abuse issues. Of course, it's voluntary. We can order it, but the statute specifically sets forth that if someone does not wish to participate or violates the pretrial services order, you cannot charge them with a violation of the conditions of release. And so that's one area for judges. And that also depends on the county. For instance, I know Ms. Farrell put together, I think, a chart of numbers. And if you look at it, what you might think, wait a minute, Windsor County, I think in 2020, fiscal year 2021 had 0 pretrial service orders. And I may be wrong on that, but I think that was the number for that county. Well, if you dig a little deeper, what you find out is the prosecutor there uses diversion up front a lot more. And so I believe his view is that he's utilizing diversion. He's utilizing those community resources before it gets to the pretrial services. And so the needs that pretrial services would otherwise address are being addressed through diversion. And so that's another area when you try to look at how things are going across our state, it's not always apples to apples. The next area where judges can utilize the services in the criminal context is when we're doing sentencing. Restorative justice panels, reparative probation to work with the individuals to repair. That is also something that it depends on the county and it depends on the case. You may have a case with a victim that the restorative program is ideal, that it presents a process for healing, for community understanding, and the victim to understand what happened, and the defendant to learn and grow and not reoffend. But you have other cases that may have the very similar charges where a victim would say, I absolutely do not want to participate in that. And that's reasonable for many people to say that. That may not make that case appropriate for reparative. And so we try on the bench to make sure that when we're doing a reparative order, we order it in cases where it's going to be effective, where it's going to be beneficial to the defendant, beneficial to victims, and thereby beneficial to the state as a whole, because it gets us what we're seeking, and that's the administration of justice and reducing recidivism. And so when we look at those circumstances, there are some counties you'll see that used more in. But again, as Representative Wood pointed out, we've got all the colors in every county, It's just a matter of, who's funding them and how they're being used, but they are available and they are being used. And our justice partners work with us on that. It's not a situation right now where judges would necessarily say, well, we don't have the resources. They may say, well, we don't have the resources as timely as we'd like them. You can get involved in the program if you send somebody to Valley Vista for treatment and they come out and they've got nowhere to go for their follow-up care. That's a problem. So that's an area that we're seeing. But as far as the ability to get to the services, our partners who are working with us in those programs are diligent, they work hard, and they care. And in fact, we had a training just this morning, it's still going on for judges, and this was one of the topics, pretrial services. And one of the panelists, when I asked the question, what do you recommend a judge does when someone says they don't want to participate after we've ordered them, and they've come and sat with you and they say, no, I don't want to talk to you. He smiled and he said, well, I take no as an opportunity to change, and I take no as an opportunity to get them to do something different and that keep the conversation going. And that's the commitment you're getting from our partners. And so, with that, I think that we do have the resources. Now, obviously, there's a lot of questions. Senator Sears, when you asked your question before, will we build a system like this? I was sitting here thinking, boy, I sure hope not. As you know, I took over for Judge Grierson last fall, and I'm the NKOTB, the new kid on the block. And as I sat through many meetings, I would wonder, wait a minute, what does this acronym stand for? So who's this group and what's that group? And I kept thinking, wouldn't it make more sense if one person had the checkbook? And instead of all the different counties competing for what the rules were going to be or competing for grants and funds, you had one person doing it and spending the time and that focus. And so, obviously, it's not an easy situation. But I think John Campbell said it best when he commented that sometimes when the foundation is not there, you have to make some of those tough decisions. So I'd be happy to answer any questions any of the members may have.
Questions? I think your testimony's been very, very helpful.
But I do have one.
Yes, sir.
Yeah.
Oh, go ahead.
So your last statement was intriguing, that does it make sense that one entity has the checkbook? And I don't know if I heard an answer from you.
Well, what I mean is, it just seems to me that if you have 14 different entities all going for the same dollars, why should they be competing? Don't we get strength in having 14 together and coming on a common goal? And doesn't that common leadership and that common goal serve exactly what you asked your question on before, geographical diversity? Instead of everyone setting up their own systems, we have the legislature or centralized system set up that everyone can benefit from. And obviously, that system would have to bring with it the ability for individualized recognitions in the counties of how it's going to be operated. You're not going to have one system that's going to fit perfectly in every county. But if you have the system idea set up and you have the ability to work within the counties to maximize the funds and the resources, that might be better than having 14 separate systems. And again, different systems within the systems.
I certainly agree with that.
Yeah, it's how to get there.
How do we get there?
Exactly.
We're looking for your help. How do
And
we
what's
get
the
there?
entity of that one?
Yeah.
Well, I think that's the Willa Farrell. And the other justice partners to give you some ideas on that.
Okay.
Well, that was my
All right.
next shift, to go to our Attorney General's office.
Thank you.
Thank you very much. Have a great
Thank you,
day.
Judge. So Willa, why don't you come on up, Willa? Saying that this was a nice transition. And then we'll do Department of Children and Family Services, and then we'll take a lunch break.
Well, good afternoon, committee. For the record, my name is Willa Farrell. I am the Court Diversion and Pretrial Services Director at the Attorney General's Office. I'd like to start with a chart that I sent to Peggy earlier, which I believe you all have. I do have some paper copies if people would prefer that.
Typing must be a challenge with your.
No.
Oh,
Uh-oh.
the one finger stuff works sometimes. guess I should just done the.
We need one for Peggy.
I think that.
She has one.
I have one more too. Oh, he's got it. Okay.
Sorry, I was not most efficient. Distribution. I think what this chart, which I developed along with my colleagues from DOC and DCF, as well as a representative group of the entities which we all fund, what we hope this chart demonstrates to you is that in every county, there are the same set of services. We took just a snapshot of a statewide perspective, and we used the sequential intercept model to document the distinct services that we fund. So you can see early in what we call point zero, the community, that both DOC and DCF fund services that are detailed here. I'll jump to the area which I can speak best to, services we fund, which are also all pre-adjudication. And I'll start with point 2. We have court diversion and pretrial services. We have statutory authority. I'll say that those statutes really help us to ensure that the services we are delivering in each county are similar. And a few people have used the term of accessing services. And I think I'd like to stress that people come to our services because they are referred to us. It's very different than accessing health services or a food shelf. They may be voluntary, but they are offered and directed to us. And these services exist, as Representative Wood noted, in every single county in Vermont. You can see on this chart who refers to our services and whom we serve, youth and adults, and our funding. I could take more time to explain our services.
We're going to spend part of our next meeting doing a little deeper dive. This is more the overview of what's there for services, how you're working together, the financial support, how people get into those services. So this is the first layer.
Okay. Well, I guess I'd just like to stress is that the services on this chart really, it's the state's attorney, as Judge Zone outlined, who really, or the prosecutor who makes decisions as to whom to refer. There is guidance in our statute, which is very helpful, that says that expungement eligible misdemeanors should be considered for diversion, but it is the prosecutor's discretion. I do think that in the youth system, a very useful and helpful approach that has developed in recent years is looking at the risk level of the individual. So, and Lindy Boudreau from DCF could speak more to this, but we within diversion, as well as other funded parts of the system, use a screening tool, the YAZI, that really looks at the risks of youth as well as their assets and protective factors. And those considerations may lead a prosecutor to make a decision that might look puzzling, perhaps, to an outsider who only looks at the charge, which is often how we look at these issues. The risk level is really, I think, throughout the system, something that we'd like to take into account. If people are low risk for reoffending, we don't want to spend a lot of time involved in their life, and we want to do individualized services.
So, well, can I just, I'm looking at the funding source here.
Yes.
And I see that the Attorney General's office, you're funding the court diversion and you're funding the pretrial services, but I'm also seeing in point 1.
Yes.
That you're also funding for the youth.
Yes.
This is where law enforcement would then make these referrals or decisions.
It is, and it's specific to underage possession violations. So
Possession of substance or possession of alcohol?
Of both. Well, of alcohol, cannabis, and actually buprenorphine, small amounts of buprenorphine, which in an attachment, I detail a little more about the services. And that actually is somewhat unique in that the statute says that law enforcement shall refer youth to it's a voluntary program. And that's an alternative, it's a diversionary process from the civil system, from the Judicial Bureau.
So is that what the SBIRT refers
Yes,
to?
I'm sorry that used my acronym. That's screening, brief intervention, referral to treatment. It's a health approach.
But it's almost like diversion in a way.
It is similar.
Okay.
And I think the other point I'd like to make about our services, pretrial services, I would say is different than a restorative justice service.
Right.
Restorative justice is not a program. It's not a service. It's an approach. And pretrial services, as well as our youth substance awareness safety program, the ESPER underage possession, are really health-focused services. Those services are to connect people to treatment as their risk level indicates. Our court diversion program is really about diverting people out of the court, whether they're a youth or an adult, and using a restorative approach to make amends and address the harm. So included in this chart, I think the term restorative justice is both too encompassing and too narrow. There's a lot of work in Vermont that is restorative justice that isn't captured here. The Agency of Education, for example, funds work. I think there's value to other departments in state government looking at how restorative justice could be used to help them deal with conflict or wrongdoing under their jurisdiction. So that's how I think this is in some ways narrow or broad. And then in some ways it's narrow because some of what is here is not strictly a restorative justice program.
So restorative justice is more the terminology or the model.
Yes.
And then it gets applied on individual levels, like if it's being applied in our school systems.
Right.
Yep. It's a different system, but it's using the restorative model.
Yeah, practices, principles.
So when further in your document, when you use, like you go to the Attorney General's office, community justice programs, what you're funding are the programs, court diversion, Tamarack, pretrial services, the substance awareness safety program, and the DOS diversion program. That's what you're referring to when you say community justice program. So it's not going to, is it or is it not going to community justice centers?
In some instances, it is going to community justice centers, but to back up for 1 minute, all of these services are encompassed in one grant agreement per county. So we fund one organization per county. In some of those counties, it goes to an organization that is also funded by DOC and may call itself or may be viewed as a community justice center. For example, the Burlington Community Justice Center is one of our grant recipients and receives a grant to provide all these services. In Windsor County, we fund an organization called Valley Court Diversion that provides all these services. In Orleans County, we fund the Community Action Group. So I could give you, I think off the top of my head, maybe 5 or 6 of the organizations we fund are also funded by DOC and might be considered a CJC. But that, as I think Ben referenced, it's a term that can be used to an organizational structure. And it sometimes, I think, is used to describe services. And I've heard my colleague Derek Miodovnik talk about the CJC scope of services, which I think is a way to try to clarify that what each of us fund is a set of services to organizations, which, as Senator Sears referenced, also obtains other funding sources to do other services.
Mm-hmm. So we do have a question. Senator Sears?
Yes, actually, I'm looking at your fourth chart and trying to understand the DLS services.
Yes.
And why Chittenden County had 0 in both FY 22 and 21, and I see many other counties with smaller numbers, but no zeros. Even Grand Isle and Essex County had DLS cases. So it doesn't, they don't have a, you know why?
Yes, and I should have put a note, that really was a tracking system error when we moved to a new tracking system, and that is I really should have addressed that. So I really appreciate you pointing that out, Senator Sears. I will say that in Chittenden County, they actually received many referrals directly from law enforcement prior, that are sort of pre-charge referrals.
But
Yes.
I wonder, I just wanted
Yeah,
to
no.
that Chittenden County isn't ignoring DLS, all that effort. We put a lot of that. Over the years, I think it's probably one of those areas of criminal justice that is boggling, the number of people that have licenses suspended and continue to drive.
And I will say the changes you've made, Senator Sears, have made a great impact on people's lives. I was just talking to a judge from the Judicial Bureau this morning, and they have seen that impact too.
Good news. Thank you for clarifying Chittenden County. I just feel worried.
Teresa, and then I want to shift to DCF so we can have lunch before the cafeteria closes.
Thank you for this chart and information, Willa. It's very helpful. So could you describe for us the, I guess, ongoing communication and collaboration that the 3 funding entities have regarding this whole sort of suite of services and programs and sort of overall approach? And how do the 3 entities work together to think about, impact on individual programs out there of, one department delaying an RFP process, another department, investing more money into COLAs, but maybe another department didn't. How do you folks work together sort of on, I guess what I would call the overall administration of these suite of services?
So I meet monthly with my colleagues, Lindsay Boudreau and Derek Miodovnik, and we talk about a range of topics. So for example, we are always looking for ways to partner amongst the 3 of us, as well as to promote partnership and collaboration amongst the organizations that we fund. This past spring, we held a conference that looked at racial equity issues that was geared to volunteers. We had, between our 3 sets of funded services, we have over 1,000 Vermonters who are volunteers. So we had this pretty amazing, if I say so, conference this June. So we look for, those are probably the easier areas to collaborate: training, professional development, services for volunteers. And that includes, for example, buying resources together and ensuring that similar resources are distributed to our funded agencies. We talk about how do we support collaboration in local communities. We've hosted meetings where we ask program directors or agency directors from our different, in communities where it's different funded organizations, to come together and talk about how can we support you to promote collaboration. And in many areas, there's very strong collaboration. People will refer, they may show up at a CJC and get referred to our funded agency to learn about DLS. So in terms of administration, our funding, we have different funding streams, different appropriations, and business offices. So we certainly have commonalities in terms of, in the minutia, we all have attachment C, as you probably remember, attachment C. But we have different grant agreements. We do tend to, we all issue those on a fiscal year. We follow, state competitive procurement processes and issue RFPs.
So I'll ask a sort of very specific question. So we heard earlier from DOC that they gave out COLA increases. I'll ask DCF the same question in a moment, but so did you give out COLA increases? Did you guys talk about that prior to that happening? Because it sort of creates inequities in the services and.
So as you can imagine, every year, and Representative Squirrel can tell you this, when I go, and Senator Sears too, when I go to the Appropriations Committee, I make a request for additional funding when the Attorney General has supported that effort. And the most recent Attorney General has supported those requests. And we have been able to obtain additional funding the last few years. We had this current year was a 3% increase. We haven't framed it necessarily as a COLA because there are many drivers for financial pressures, including caseload increases in our services in the last few years, not so much more like pre-pandemic. So funding is an ongoing it's an ongoing pressure for us. We have fees that support our services, and that is not a sustainable funding stream for us. And so the financial pressures are real and ones that we are always advocating for more resources. And so I could give you, I can't remember off the top of my head which years we've given increases, but in many of the past 5 years, we have been, when we get the appropriation, we have a somewhat unique situation that there's a direct line in the state budget for court diversion and pretrial services. And that goes directly to the agencies we fund.
So, depending upon decisions of the legislature.
Yes.
Which may or may not be equal among the three departments, you have differing abilities to provide any kind of increase to those contractors. And I would really caution us not to think about caseload increases as being in that same mix as COLA, because it's definitely not. Okay, thank you.
So I'm going to shift now because I'm concerned we got to get up to the cafeteria before for lunch.
I'm sorry for asking so many questions, Madam Chair.
No, but it might close around 1:30 too. They're not in full swing like they are during this session. That's my concern. So Lindy Beaudry? Boudreau. I have trouble with that. That's okay. So Lindy, welcome. And if you could identify yourself for the record, and I think you kind of know where we're headed.
Exactly. Thank you. I'm not going to stand between us and lunch. No.
That's not a good position.
So for the record, Lindy Boudreau from DCF, I'm the Juvenile Justice Director. I just one point to clarify. Originally, we were asked to provide details about the barge program. Given the shift in the conversation today, is that something you would like me to submit for the committee?
Why don't you submit that, and then as we start doing a deeper dive, hopefully in 2 weeks, we can get into.
Yeah, and you'll see the attachments that I submitted already were in that vein. So you have some information, but I'll submit that to the committee. Thank you. So just to kind of pick up the pieces of the conversation. The barge contract, the balanced restorative justice contract, we do have equal representation across our AHS districts. We fund 11 providers. One of those providers covers 2 of our AHS districts. We do have full coverage across the state in the 14 counties, even though a couple of those counties don't have their own barge provider. We do have coverage in those areas. So there is equal access, to use that term that's been used today. As Will mentioned, its access is not the same as it might be for other things like healthcare, for example. There's a lot of services that are referred through the court system. As you'll see on this chart that we developed, point 0, barge services start there. And the unique piece about barge is that it is the opportunity that we have at DCF to provide prevention services to youth who are at risk of becoming involved in the justice system or are already involved in the justice system. So that's a unique benefit that we have of that program. And I know in previous conversations, Senator Sears has referenced his provider network down at the Restorative Center in Bennington. This is something that provider really highlights well. So it is something that is available throughout all of the contracts for barge. So barge services are contracted. They're no longer grants. We do follow the competitive bid process. There's an RFP done for that. The budget, to speak to Representative Wood's question earlier, you all may remember that some of the barge providers came to the legislature and sought additional funding, and you gave them an additional $250,000. Thank you for that. That was the only increase that we were able to provide this year. And so their current budget is $1,141,000. And so it's the smallest budget of all three providers. Folks may also recall from the testimony of the barge providers that we are looking at opportunities for leveraging federal funds to be able to increase that budget. Those conversations are still happening within DCF and the agency, and I'm hopeful that will bear some fruit. Let me see, trying to see what else you might want to, another thing I wanted to follow up on, Willa did a great job outlining the relationship that we have as the three providers who fund this. One thing I will just expand on is I feel like, folks have identified that to build this system, we have, instead of one big foundation, we have different blocks that have kind of built the foundation over time. Although it may not be ideal, I feel like now within the network that we have and the work that we do as the funders, we've really built a really solid foundation. Even though it does look a little disjointed, it works really well. Our provider network, feels supported, when there has been changes at the local level with maybe a community justice center, the three of us all still meet to say, how might this change the dynamic in that community? Is there an opportunity to strengthen the services? Are there gaps in that community that we might be able to help through community conversations fill those gaps? And I can say across the board, the communities that we work with have been supportive of that. That's happening recently in a county where there's been some changes with some at the director level. And so I feel like we model collaboration in the three of us and how we manage the contracts and grants, but also provide that support to the local level. A key piece of this work is really the fact that that there's flexibility at the local level to be able to respond to what their community's needs are, not just through the population that they serve, but also through the resources that they have available in other services. And that was mentioned earlier. There's a big difference between what might be available in Chittenden County with all the various services versus Newport, for example. So for me, at least from the barge program, and that really is something that's extremely important. So we can have flexibility to respond to changing needs. And certainly within the youth justice side of the work, you've all seen changes since 2016. There's been significant changes. And if we had to go back to you all to say, can we change the statute every time we needed to be responsive to the changing needs, it would be a big lift. So although some of the services, as you see in here, are legislated, we did that to account for the fact that there may be some discretion. There is discretion that sits with the state's attorneys around referrals. So the legislature built in certain opportunities for like the YASI, the Youth Assessment Screening Instrument, to be offered to youth prior to being a prosecution decision being made around court diversion, for example. That was something to, again, get to concerns around equity. So there are things that have been built in, and that's part of what DCF overall is tasked with, but we really lean heavily on our barge providers to implement. I'm being quick because I need to get to the cafeteria. So I'm just looking at my notes. I'm not sure if there's other questions that folks. Questions?
I know, you're looking at me, I'm like trying to be respectful of people's stomachs, that's all right?
No, but you were going to ask the same question.
Well, I mean, I feel like Lindy's answered the question, you know, because she knew I was going to ask it, so.
I'll wait, yeah. Thank
You'll
you.
be back.
And I'll submit the detailed information about the program. Great. Thank you.
And thank you all for the patience this morning. It was a heavy lift. I know we've put off DOC, but we'll pick up after lunch. Half hour for lunch, is that what people would be comfortable with?
Sure.